I think it's not required. Yes, good morning, students. Um, Now, in this class, and since it is a new class and the first class for this course, social demography, so we'll be studying about the what is the meaning of social demography, and I will try to understand how it is related to sociology and how it is related to wider society in studying population and its characteristics. So, in this class, we'll try to explore and explain the meaning and definitions of social demography, and we'll be making an attempt to describe the nature and the subject matter of social demography, and also we'll be making an attempt to understand the relationship between society and population. So we'll try to understand that how the social demography is relevant to study the population growth and its patterns in India. So in a way that this class is going to be exciting in one way, that this course this class is tries to understand the social demography in a much larger context. Now we'll study what is social demography. Friends, as you know that the social demography is a branch of sociology that studies population in relation to society. Population is not merely a collection of individuals. It is shaped by social structure, culture, economy, education, religion, and political systems. Similarly, population changes also influence social institutions such as family, marriage, economy, education, and polity. Therefore, demography as a discipline, it studies the size, distribution, and composition of population and the changes in population through fertility, mortality, and migration. So, social demography goes one step further, and it studies the social causes and consequences of these population changes. For example, fertility is not only a biological process but also a social phenomenon, because it is influenced by age at marriage, education, religion, customs, and economic traditions. Similarly, migration is also influenced by employment opportunities, urbanization, industrialization, and social mobility. Therefore, social demography helps us to understand the interaction between population and society. So, as regards the meaning of social demography is concerned, social demography refers to the study of demographic processes in their social context. It examines how social, economic, cultural, and political factors influence population changes and how population changes affect society at large. So, in a way that the definition of social demography is that social demography is the study of population and its relationship between with social institutions and social processes. It is the sociological study of fertility, mortality, migration, and population composition. So social demography, it studies both, which means it studies the social determinants of population change and it also studies the social consequences of population change. In other words, it studies the both cause and effect of population changes in society. And as regards the component of social demography is concerned, the main components of social demography are fertility, mortality, migration, and population composition. So, what is fertility refers to? Fertility refers to the number of children born in a population. It is an important component because it directly affects population growth. And the lot of social factors affects the fertility of a given population structure. For example, age at marriage, education of women, employment of women, urbanization, religion and customs, economic status, family planning, government policies, and all these factors, affects the fertility structure of a population, component. In other words, for example, an educated and employed woman tend to have fewer children compared to uneducated women. Friends, as you all know that particularly when it comes to cities, that those who are educated, there are a lot of population changes are occurring in India, and many people are migrating to cities in search of livelihood, in search of employment, in search of education, in search for a decent and dignified life. So when they land up in urban landscape, it is not merely possible because to maintain big families. Therefore, a lot of educated couple, they choose the children selectively. For example, they don't go for a second child, or they don't go for the third child. So maximum they restrict their children to two only. It's primarily because it is the maintaining of children in the urban context is not that easy, because it is governed by a lot of economic challenges, lot of the security and other challenges. So as a result, that educated and employed women, they tend to have fewer children compared to uneducated women. Therefore, this affects the fertility of the given population. And the next component of population, I mean the social demography, is that mortality. So what is mortality? Mortality refers to the number of deaths in a population. So what are the factors that affect the mortality? The factors affect the mortality are availability of healthcare, nutrition, sanitation, drinking water, diseases, poverty, environmental conditions, and so on and so forth. Which means what? The factors affecting mortality are, as I told you, that availability of healthcare plays a huge role. And there are reports that suggest in Indian context that just because that that lack of access to basic health care resulting in lot of deaths in India, that many poor people and who reside in the rural areas and hinterlands of forest belts, and particularly the tribals, and who do not have the basic health facilities in their areas. As a result, when the disease develops, when the disease develops into an advanced stage, they fail to get proper health care, because a lot of healthcare institutions are absent in their localities. As a result, that it's because that non-availability of proper healthcare results in deaths of the population. So this is the major issue. As student of sociology, we have to think that the public health is in a major crisis today, because on the one hand, the state government is unable to push and strengthen the public health sector, and which results in the spurt growth of private sectors, private hospitals at large. And these poor people, they don't they can't afford to go to private hospitals to get proper treatments. As a result, the many people and who don't get the proper health care in a right time. Why I'm using the word right time? Because most of the cases, the poor people, they don't go to the hospital just whenever they fall sick or fall ill. It's because that they it is again governed by lot of the socio cultural factors. For example, as you all know that whenever there is a cut and wound in the body, suppose if there is a blood is bleeding, there is a bleeding on the body. Generally, in the homes, what in the rural households, what generally they do is that they use turmeric. They use turmeric to cure that wound. And there are a lot of socio-cultural factors that plays a huge role. That there are a lot of times the these cultural traditions govern on the bodies, and as a result, these people, they don't go to the hospitals in a right time. So when the wound develops into a very trouble stage, they go to the hospitals. Of course, whenever they go to the hospitals, it is, even if they get it access to healthcare, the wound in their body develops into a very turbulent stage. So as a result, yeah, the mortality increases in that given population. So the availability of healthcare plays a huge role in affecting the mortality of the population. And also, of course, yeah, the nutrition plays a huge role. As you all know that the nutritious food plays a huge role in maintaining the healthy body. As reports suggest that the many women particularly, and also the children, who get very less amounts of nutritious food. As a result, there is a lot of malnutrition cases are increasing in India. The poor people and who can't afford to have a healthy food, and they tend to fall into the trap of malnutrition. As a result, as malnutrition in their bodies deteriorates, increases, what happens is that their health status lands up in a danger state. This results in a again death. So therefore the nutrition plays a huge role in maintaining a healthy body. And of course, the another factor could be the sanitation and drinking water. Now I'm using the word sanitation because most of the poor households, if you can see that, particularly when it comes to the cities, there are a lot of slums are growing day by day. And the slum, why the slums are growing day by day? The poor people, for example, when it comes to Hyderabad, the poor people, as soon as they land up in Hyderabad, from their rural areas, or they can't afford to live in a luxurious apartment or in a decent colony because the rents are so huge. They can't even afford. So as a result, what happens is that they live in a slum. Generally the slums are not recognized by government, or if they, even if they're recognized by government, there are a lot of the facilities, like basic access to water, sanitation, electricity, and so on and so forth, are in the, in a miserable state, in a way that the particularly the women and children in those slum areas face a lot of problems. They don't get proper public toilets or private toilets, and the surroundings are like completely smell, with a lot of drainage flows in their streets. As a result, the sanitation problems causes, affects their health at large. So this sanitation also plays a huge role in affecting the mortality of their population, of course. And the drinking water. And as the report suggests that most of these rural areas as well as the slum areas, they don't have a proper drinking water facility, though the government is providing water pipeline to each household. That there are still many areas that this drinking water facility is not there, particularly when it comes to the interior parts of tribal areas, they hardly get water, access to water, drinking water. As a result, they depend on either bore wells or nearby ponds on river streams. So this also, the lack of access to basic drinking water, also affects the health status of the individuals, which results in the increase of mortality rates. And and another factor could be is that the poverty condition. Of course, as I told you that most of these factors, it affects the poor people. The poor people are nothing but they are the they those economic levels are very in a dangerous way. So therefore, those poverty levels actually influences on their uh, health status, because that the poverty actually determines what to eat, what not to eat. It's like, so suppose if you have more money, you tend to have nutritious food. Suppose if you don't have a proper money, what you do, and you just satisfy with whatever you get, right? Though the food is not that much nutritious. So this poverty also plays a huge role in determining and affecting the mortality of the population. And another important factor could be is that environmental conditions. Friends, as you all know that the environmental condition also playing a huge role on the society. That it is due to the increase in industrial pollution, and that pollution also results in the water contamination, and the air quality. And as you know that suppose if you take the example of Delhi, the Delhi levels are like, there most of the residents in Delhi are facing a lot of health issues, particularly respiratory issues. It's because that the air pollution is like going beyond one's imagination. And what is going to happen? It is actually affecting the mankind at large, not only the mankind but also entire ecology. So which is actually causing a huge role on maintaining the health status of individuals, and which is actually resulting into mortality. So therefore these mortality rates are lower, when it compared to lower in the sense in compared to developing countries and poor regions. So another important component of mortality that affects is that affects the population structure is that the migration. So what is a migration? The migration refers to the movement of people from one place to another for permanent or temporary settlement. As you know that there a lot of migration happens in Indian context also, particularly the rural to there are different types of migration. Particularly the rural to urban is one type. The second type is the urban to rural, and third one is the rural to rural, and fourth one is the urban to urban, and of course the fifth one could be the international migration. So when it comes to the Indian context, that the rural to urban migration is also happening, and urban to rural also is happening, rural to rural also is happening, and urban to urban also is happening at the same time. So this causes a major effect on the mortality rates. So the causes of migration could be the employment opportunities, education, marriage, natural disasters, war and conflict, industrialization, urbanization, and so on and so forth. Therefore, the migration leads to urban growth, cultural change, and social mobility. And the population composition, in a sense that now let us discuss what is population composition. The population composition could be is that the population composition refers to the structure or characteristics of population, which includes age structure, sex ratio, literacy rate, occupational structure, rural urban population, marital status. you know age structure of the population plays a huge role on the population composition. And of course, the sex ratio also plays a huge role. Literacy rate and occupation structure, rural to urban, the population migration, marital status, and everything. All these factors plays a huge role, in affecting the population composition in a society. Therefore, while we attempt to understand population composition, it helps us to understand dependency ratio, workforce, economic development, and social development. As regards the nature of social demography. Now we'll try to understand what is social demography. I mean, what is the nature of social demography? And the term nature refers to the characteristics and features of social demography as a field of study. Social demography is not just the statistical study of population, it is the sociological analysis of population processes and their relationship with society. And as regards the nature of social demography is concerned, it is interdisciplinary in nature, which means that the social demography is interdisciplinary because it borrows concepts and methods from many social sciences such as sociology, economics, geography, political sciences, anthropology, public health, and statistics. The sociology generally it studies, as you all know, that it studies social structure, family, marriage, culture, etc. Economics deals with economic income, employment, poverty, development, etc. Geography deals with the population distribution and migration patterns, whereas political science also deals with the population policy and governance. Anthropology deals with customs, traditions, fertility, behavior, and so on and so forth. Public health as a discourse deals with mortality, health conditions of a given population. It also deals with the statistics. Statistics deals with census and population data analysis and so on. The social demography is a meeting point of many disciplines. It is a meeting point of many disciplines. The another important character, even the nature characteristic of social demography is that it is analytical in nature, which means what? Social demography does not simply describe population numbers. It analyzes the social reasons behind population changes, which means that unlike the population studies, generally population studies deals with numbers, but whereas the social demography deals with the social reasons, causes, and consequences of those population growth and decline and changes and so on and so forth. So, therefore, the social demography, the analytical nature of social demography is to understand the social reasons behind population changes. For example, why do educated women have fewer children? Why do poor people have higher fertility rates? Why do uh, people migrate from village to cities? And why is mortality higher in uh, some places, some regions? And this question should show that social demography is analytical and explanatory in nature. And it is also dynamic in nature. Which means that dynamic in the sense that it studies the changes in population structure. So population is always changing because due to the birth, deaths, and migration. So these changes affect social institutions such as family, marriage, economy, education, and employment. Therefore, social demography studies population as a dynamic and changing phenomenon, not a static one. And scientific nature. And it is also scientific in nature. Social demography is scientific because it uses the census data, surveys, vital statistics, birth and death records, sample registration system, National Family Health Survey, and statistical methods and population. Therefore, the scientific nature of popular social demography is that it is based on the data, measurement, and analysis, and certainly it is not on assumptions. And it is social and cultural nature. Population behavior is influenced by customs, traditions, religion, beliefs, social norms, family system, marriage system, and so on and so forth. For example, early marriage increases fertility. Son preference affects sex ratio. Religious beliefs influence family planning. Therefore, social demography studies population within cultural context. Within cultural context, and it is also the nature of the social demography is also indicates that it is a policy oriented nature. Social demography Social demography is useful for government and policymakers. For example, to study population policies, to design and implement family planning programs, health policy programs, education planning programs, employment planning programs, urban planning schemes, and rural development measures. So, social demography is applied and policy oriented because it also involves in policy oriented nature. And it is also concerned with the development oriented nature. The population and development are closely related. Social demography studies population and economic development, population and poverty, population and unemployment, population and environment, population and urbanization. Hence, social demography is development oriented discipline. Students, as regards the scope of social demography is concerned, as regards the scope of social demography is concerned, the scope of the terms scope refers to the subject matter or areas covered under social demography. The scope of social demography is a very wide. The study of population size and growth. Social demography studies population size, population growth, population density, population distribution. It also studies, social causes of population growth and its impact on society. It studies the fertility. It studies the fertility in the sense that it studies the birth rate, fertility rate, age at marriage, family size, family planning, social and cultural factors that affects fertility. It also studies economic factors that affects fertility. And it also studies the mortality structure, which includes the death rates, infant mortality rate, maternal mortality rate, life expectancy, health conditions, nutrition, sanitation, disease patterns, and so on and so forth. And it also studies the migration patterns. It studies the causes of migration. It studies the types of migration. It also studies why there is a rural urban migration, why there is a urban rural migration, and so on and so forth, and what are the reasons for migration, and what will be the consequences of those migration patterns. And it studies the urbanization. It studies the industrialization in a way that it studies the causes and consequences and its impact on society. It studies the urbanization effect on society. So, therefore, it also studies the problems and of slums and particularly in urban areas. It also studies how this problem, the migrations affects the social mobility of the population. Therefore, the social demography, in a way, as you see that it is a wider subject. It is not a simply one-to-one subject. It has got a wider angle, and where it merges and submerges and it converges with a lot of other disciplines, and particularly in social sciences, and to study and offer a good the insights to study population structures. And along with this, the scope of social, the social demography also studies the population compositions. The population composition includes age structure, sex ratio, literacy, occupation, marital status, and rural to urban population. So why all this study? This why while attempting to study all this, it helps us to understand dependency ratio, workforce, aging population, and youth population, and so on and so forth. So it also study population and family, which means that the social demography studies family size, family structure, marriage patterns, age at marriage, divorce, widowhood, changing family patterns. And the social demography also studies the population and economic development. It studies the relationship between population and poverty, population and unemployment, population and economic growth, and population and standard living. As I told you that the social demography is also concerned with the study of population policies. For example, population control policies, family planning programs, health policies, maternal and child welfare programs, national population policies, and so on and so forth. Therefore, friends, what I'm indicating here is that the nature and the scope of sociology, the social demography, shows that this subject is a scientific, analytical, interdisciplinary, and policy-oriented discipline, which studies the population in its social context. The scope of social demography is very wide, as it covers fertility, mortality, migration, population composition, family, economic development, population policy, environment, and social change, etc., etc., etc. So, therefore, social demography is very, very, very essential for understanding the relationship between population and society, and for planning social and economic development. Therefore, friends, what I'm here indicating here is that what I'm more indicating here is that the demography as a discipline is a very important branch of sociology. The social demography discipline is a very important branch of sociology which studies population in relation to social, cultural, economic, and political factors. It goes beyond the statistical study of population and examines the social causes and consequences of population structure change. The nature of social demography shows that it is interdisciplinary, analytical, dynamic, scientific, and policy oriented. It uses data and research to understand how fertility, mortality, migration, and population composition are influenced by social structure and cultural practices. The scope of social demography is very wide as it covers population growth, distribution, fertility, mortality, migration, family structure, urbanization, economic development, population policy, environment, and social change. Therefore, it helps in understanding major social issues such as poverty, unemployment, urbanization, aging population, gender inequality, and population explosion. In countries like India, social demography is especially important because of rapid population growth, rural to urban population, changing family structure, and development challenges. The study of social demography helps governments and policymakers in planning education, healthcare, housing, employment, and welfare programs. Thus, social demography helps us to understand the close relationship between policy and population and policy, and which plays a vital role in social and economic development and in improving the quality of the life of the people. So, friends, so this is the major, major. Yes, friends. So, with this notes, what I'm, concluding here is that the nature of social demography is scientific oriented, analytically shaped, and interdisciplinary character, and it is also a policy oriented discipline which studies population structure in its social context. The social and the scope of social demography is very wide as it covers fertility, mortality, migration, population composition, and so on and so forth. Therefore, social demography is essential for understanding the relationship between population and society, and it is very useful for planning and social development. Friends, if you have any questions, you can always ask me.